Hello, everyone. My name is Dr. Ruth Odoi. I am the founder and CEO of Oasis Women's Functional Medicine. I take care of women who are experiencing different non-specific symptoms and have normal blood work and still feel like they are not themselves. Today, I'm here to talk about vitamin D. And my first encounter with vitamin D outside of the typical role of bone health was went back in 2008 when I was a research graduate student at Tufts University. My whole research, we were looking at women who developed gestational diabetes, and we were giving them high dose vitamin D supplementation, and we would follow them years after to see if it really helped them not develop type 2 diabetes. Because if you develop gestational diabetes during pregnancy, you are at high risk for developing type 2 diabetes. And so we gave some women, we had this study group where we gave them vitamin D supplementation and the placebo where we did not give them vitamin D supplementation. And basically, we saw a difference in the group that received vitamin D supplementation. And what that tells me is that vitamin D's role really goes beyond bone health. And there is some role with vitamin D in mood regulation. There is also a role in chronic inflammation and immune health, and also a role with muscle and heart health. And so we know that sufficient vitamin D levels have been linked with decreased incidence of depression and anxiety, because we know vitamin D plays a role in the production of neurotransmitters such as serotonin and dopamine. So we do know that there is a broader role of vitamin D outside of bone health. So that's the first thing. The second thing is that in conventional medicine, we typically will only supplement vitamin D if your vitamin D level is below 20, and we would encourage daily vitamin D if it's below 30. But in holistic medicine and in functional medicine, because we realize the bigger role of vitamin D in your overall health, we encourage levels between 60 and 80 nanograms per milliliter, because research supports that at that level, we begin to see better mood regulation, and we also see a difference in energy and brain health, because it's linked to the production of serotonin and dopamine. So how do we make vitamin D in our body? So the vitamin D inactive form hormone is made in our kidneys, and once it comes out, it requires sunlight to convert from the inactive form to the active form. So you do need sunlight in order to make vitamin D in your body. So if you are a melanated person like me, you do need about 3 hours of sunlight, and it needs to be between the hours of maybe 10 o'clock and 2 o'clock, where the sun is at a particular angle, because it has to hit your skin at a particular angle to activate the active form of vitamin D. So it's very specific in how it needs to happen. So really, between those hours of 10 and 2, most people are at work. And so making vitamin D in your body is very tough, especially if you are heavily melanated like myself. So the other way you get vitamin D is through foods such as fatty fish, egg yolks, cruciferous vegetables, and dairy products. The other way to get vitamin D is really through supplementation, in order to get that level of 60 to 80 nanograms to get the broader benefit of vitamin D supplementation. So if you are not sure where you are with your vitamin D level, the best way is to get tested to see where you are. if you feel you are feeling a bit sluggish, feeling more tired, especially during the winter season, I will really encourage you to have your vitamin D level checked with your regular doctor to see if maybe you are low on the vitamin D and if you need supplementation. And so, with that said, you may need a high level vitamin D supplementation depending on your vitamin D level. If it's below 20, you need about 50,000 international units. But if it's above, 30, then you need at least 5,000 international units of vitamin D supplements combined with K2 in order to maintain that overall health that you are looking for, especially in the winter season when we don't have a lot of exposure to sunlight and your mood is a bit down because there's no sunlight, there is no vitamin D going on, and the happy neurotransmitters like serotonin and dopamine are teetering on a lower end. So, here at Oasis, we do a deep dive and we look at all these numbers to really get to why you may be feeling sluggish and maybe feeling tired. Sometimes it could be because of vitamin D insufficiency and vitamin D deficiency. So if you are in the New York area, I am open. I am taking new patients. But if you are not in the New York area, please forward this video to your friend and loved one. Subscribe to the channel. I will be coming here with more information and education on the different reasons why you could be feeling tired. We'll be talking about hormones and all these aspects of women's health. I really appreciate your time. Please know that although I am a board certified internal medicine physician, I am not your doctor. And so this is really for education and entertainment purposes. So feel free to subscribe and share with everyone. I will be back next week with more education to help you be the best version of yourself. Thank you.